could I need another surgery after RLE, cataract, and or ICL surgery? In the case of ICL, absolutely. ICL surgery doesn't prevent you from getting cataracts, and so down the line, it doesn't also prevent you from losing the ability to just see up close and far away at the same time, what we call presbyopia. So at age 50 or so, you may start to feel like the prescription is changing inside the eye as the lens starts changing, and you're no longer able to, be independent of reading glasses. So at that point, you can use glasses or contacts, or if you decide that it's time for RLE surgery, then we can remove the ICL and then do RLE surgery, replace it with a multifocal advanced technology lens to then, further improve your vision, and give you back the ability to see near and far, correct your astigmatism, correct your nearsightedness, farsightedness, all of the above. In RLE and cataract surgery, typically we don't expect that you'll need a second surgery. We have in several other videos discussed, what if the lens we picked wasn't the right fit for your eye, otherwise known as being off target. In that situation, then yes, there's a likelihood that if you continue to be off target after you stabilized, after 3 months of waiting to heal and stabilize, we can remove the lens from the eye, back calculated, put in the lens that's going to offer you better vision, or do some LASIK surgery or PRK surgery to correct that residual refraction and get you back on target. After RLE and cataract surgery, inevitably everybody needs to have a tune-up. Essentially, there will be some scar tissue growing behind the lens. It is inevitable. Everybody will get this at some point, and it's really hard to know when, right? Some people it's like within the month, although that's rare, and other people it's 15 years later. But the solution is always the same. We just take a laser, and in 10, 15 seconds, we can remove all of that scar tissue behind the lens. That scar tissue just falls into the posterior cavity of the eye, the vitreous cavity, and then gets resorbed by your body eventually. You may see that tissue, that scar tissue floating around. So it's not a surgery, it's just a procedure that gets that out of your visual axis. And then that tissue slowly goes away, but may come back and float around for a little while before it totally goes away. Otherwise, there will be few patients who will feel like the lens wasn't a good choice. Although these days the newest lenses have been just very, very good, and we haven't had to deal with this very often. But let's say you feel like the lens wasn't a good fit. This is you want a different kind of lens, and within the 1 year period we'd happily take out this lens and replace it with another lens that you choose. Now, let's say you were okay for the first year, and then down the line, some new lens came out, and you want to use this new lens because someone told you it's superior to the lens that was implanted previously. Well, we can do that as well, but that'll be at cost to you. And that surgery is going to be more expensive than RLE surgery because generally it's a tougher surgery to do. It's not widely offered, although there are going to be a handful of surgeons around the country that will be able to very easily and with adequate amount of experience to do that surgery very safely for you. Other than that, I don't think you're going to need any other surgeries when it comes to lenses. But anything and everything's possible. You just have to have a proper discussion about risks and benefits. And what that looks like is if the new lens is a smidge better, maybe it's equivalent to your current lens, but your friends are telling you that they love it and you're lukewarm about it, but you're functional and you're not very bothered by your current lens. It's just a curiosity. Then I would say probably not worthwhile, not worth the money to upgrade your lenses. But if you've But if it's significantly better, and we all think it's much better, and encourage you to try the new lens, then yes, by all means, we can talk about upgrading your lens at a future point when a much nicer lens comes out in the future. All right, hope that helps.